The femur, this is the longest and strongest bone in the body. Here you can see we have the head. It's nice and round. That's going to form part of the ball and socket joint of the hip. That's going to articulate with the acetabulum. This pit right here is called the fovea capitis. What passed through there is the ligament of the head of the femur. It'll actually run through there and attach to the acetabulum to help pull it in the socket. We have the neck, which is the weakest part of the femur. Oftentimes when you hear about a broken hip, what they're usually referring to is this region here that's fractured. You got the two trochanters. You've got the greater, which is pretty prominent, and you have the lesser. Greater trochanter, lesser trochanter. They're attachment sites for the thigh and buttock muscles. In the back you see a line running through here. This is called the linea aspera. You might see a little bit better there. Right here. That's an attachment site for the biceps femoris, which is one of your hamstring muscles. You've got the gluteal tuberosity right here. You can probably guess what attaches there. It'll be the gluteus maximus. It's that raised region right there. You've got the two condyles. Just like with the humerus, remember, heads always point medially. So where the side of the head, this would be the medial side. This would be the lateral side. Heads always are on the medial side. They always point medially. So this would be your medial condyle. This would be your lateral condyle. You can see that's going to form part of the hinge joint of the knee. So medial, which is on the side of the head, and then we have the lateral condyle. And on the outside of that, you have the two epicondyles. Well, if this is the medial condyle, this would be the medial epicondyle. If this is the lateral condyle, this would be the lateral epicondyle. Again, use the head as a reference point on which side's medial versus lateral. The adductor tubercle, which is right here, a little bump, may be hard to see. The adductor tubercle, it's an attachment site for the adductor magnus, and we'll talk about that when we do chapter 9. Intercondylar fossa or intercondylar notch. Well, if these are condyles, inter meaning in between, this is the intercondylar notch or intercondylar fossa. Actually, there's several ligaments that actually pass through here that help stabilize the knee. The patellar groove or patellar surface would be this region right here. That's going to articulate with the patella. I do want you to know how to tell left and right on the femur. It's pretty straightforward. Put the head medial. Look at your condyles. Look which way they're oriented toward the back. So remember, when you flex your lower leg, it's going to go posterior. Also look at the gluteal tuberosity. Put that posterior. Put the head medial. Look which way the condyles are going. This is actually a right femur. This is a right. Look at your patellar surface. That's where your kneecap is going to be. So we can't put that posterior. Here's the head, patellar surface. This is a right. Right femur.